Non-steroidal anti-inflammatory drugs, often known as NSAIDs. In this video, we will look at the mechanism of action, what are in which disease process or what are the indication to use this medication, side effects, nursing consideration, and some examples. So let's talk about the mechanism of action. So we have a arachidonic acid on a body, which is often converted into cytoprotective prostaglandins in our body by COX-1. Now, what is COX-1? COX is cyclooxygenase enzyme. Now, what is the function of this cytoprotective prostaglandin? The first, gastric protection. This prostaglandin protects the stomach by producing that mucosa that protects stomach against its own acids. The second one, it increases platelet aggression. So blood clot formation happens really fast and it stops the bleeding anywhere from the body, which is kind of protective mechanism that this cytoprotective prostaglandin does have. It also protects the kidneys as well. It causes the vasodilation and also the bronchial dilation. Now, whenever there is a tissue injury in our body, anywhere, tissue injury, this arachidonic acid will be converted into the inflammatory prostaglandins. By COX-2, which is cyclooxygenase enzyme 2. Now, what does this inflammatory prostaglandin does? It causes the inflammation, pain, it regulates hypothalamic temperature. So what it does, it increases the temperature of the body whenever there is a tissue injury, either at the site or generalized body temperature. So those are the inflammatory prostaglandin works is. Now, this non-steroidal anti-inflammatory drugs blocks this COX-1 and COX-2 both. So these drugs which blocks COX-1 and COX-2 called as non-selective NSAIDs. Now, there is only one drug available in the market which only blocks COX-2, called as selective NSAIDs. And we'll take a look at some the examples of non-selective and selective NSAIDs in the following slides. So, this is the basic mechanism of action of non-steroidal anti-inflammatory drug that blocks cyclooxygenase enzyme 1 and 2. That's why it's often called as cyclooxygenase inhibitor as well. And by blocking cyclooxygenase 2, it blocks the inflammation, it decreases the pain, and it decreases the temperature of the body. So as you know now that decreases inflammation, pain, and temperature, what is the use of this medication? It is used as the mild to moderate pain. It also used as an anti-inflammation to decrease the inflammation, and also used as an antipyretic to decrease the body temperature. Now, these drugs are often used for the pain, which is associated with inflammation, not any other kind of pain, usually, because it works better if the pain is due to the inflammation. So these are the three main reasons these medications are used for. However, you may have seen patient on aspirin after myocardial infarction or a stroke. So there is a drug, aspirin, in this non-steroidal anti-inflammatory drugs. Now, if you take a look at back here, it blocks the cyclooxygenase 1. So it's gonna, instead of increase it, it's gonna decrease the platelet aggression. So it's gonna make blood thin. So because of that, this aspirin is used after myocardial infarction to prevent the further formation of the clot and stroke, and also myocardial infarction and stroke, to prevent the further MI and stroke. However, if the patient are on aspirin, they still can have MI and stroke, but this one actually decreases the significant chance of happening MI and stroke. So it's not guaranteed that if the patient's on aspirin after myocardial infarction or stroke, that they're not going to have myocardial infarction or stroke. But this decreases the chances of happening those in future. This drug's aspirin. Now, what are the side effects, and what, as a nurse, what do you have to look for, and what are the contraindications? So this is the main one often asked on NCLEX as well. Salicylism often happens with the aspirin. It doesn't happen with any other NSAIDs usually, and it often happens with the aspirin only. In salicylism, you see for tinnitus, dizziness, headache, and excessive sweating. So when the patient goes on aspirin at home, you want to teach them about, like, if you see any like a ringing in ears, like tinnitus, any dizziness, consistent headaches, or any kind of excessive sweating, call your doctor as soon as possible. Now, since we understood the mechanism of action, now if we block the COX-1, cyclooxygenase 1 enzyme, it's not going to protect the stomach anymore. So it can cause the gastric bleeding and as well as the peptic ulcer. Now, since it's gonna decreases the platelet aggression, it can cause the prolonged bleeding. So after like a cut or some kind of trauma, it'll be blood will take longer to clot than usual time. This drug can cause nausea, vomiting, diarrhea, dizziness, and rash as well. Since one of the main function of cyclooxygenase 1 enzyme that converts into the cytoprotective prostaglandin that protects the kidney, now it's not going to be protected anymore, since this non-selective anti-inflammatory drug is going to block that COX-1. So it can cause the kidney failure, especially with ibuprofen. And this medication can cause the retention of fluid and so edema as well. The next slide's covering some examples of non-steroidal anti-inflammatory drugs. Now, we talked there are some anti-inflammatory drugs that's non-steroidal are non-selective, and some of them there's only one which is selective. So these examples are all non-selective NSAIDs. So this drugs blocks COX-1 and COX-2 both, while this celecoxib, it only blocks COX-2. So celecoxib doesn't have the side effects like stomach bleeding, kidney failure, prolonged bleeding, those kind of, because since it only blocks COX-2 enzyme, not the COX-1. There were many drugs in the market that only inhibits COX-2, which is often called as a selective NSAIDs, because it selectively blocks COX enzyme, cyclooxygenase 2, so COX-2. However, there was a data coming from the users that it can cause the cardiac events like MI. There were high risk of a heart failure, like so forth. So most company took those drugs out of the market. There's only one drug in the market right now, which is selective NSAID, is celecoxib. So that's the only difference between this non-selective and selective. And often they, on NCLEX, they either use the aspirin, ibuprofen, diclofenac, phenoprofen, ketoprofen, naproxen. Those are the most often tested drugs in NCLEX. So that was it about the NSAIDs. If you have any questions, you can contact us or put a comment.